Hello, I'm David Cantor, and I am a staff attorney in San Antonio. As a staff attorney, one of my roles is to provide legal orientation services to detained immigrants. Before the coronavirus outbreak, our staff were physically present at these centers 4 days a week. Ever since the pandemic, we have still rendered these services remotely to these detained immigrants. Undoubtedly, you have seen news of the COVID outbreak in these detention centers. Our staff and our volunteer attorneys have been working to secure the release of detained immigrants, especially those most susceptible to the coronavirus pandemic. Last month, I worked with Mr. C. Mr. C is a 30-year-old man from Cuba. He came to the United States seeking asylum after he was tortured by his government due to his political beliefs. And when he arrived to our border, he was immediately detained by ICE. By the time I met Mr. C, he had been detained for 5 months already. He told me he had asthma, and this made him much more at risk of contracting the coronavirus. Mr. C and I worked together to obtain his medical records from Cuba and to prove his condition to ICE. However, our initial request for release was denied. I continued to advocate for Mr. C. I continued to approach ICE and insist they read the record twice to prove that he indeed had asthma and he was at danger of contracting the coronavirus. Finally, the request was approved, and he was finally released from detention. And now, although his fight is not over yet, he is now free from detention and able to seek his asylum and freedom in safety alongside with his family. Thank you for helping American Gateways.